Tummy tuck is one of the most common procedures that I do. It's also something that we call abdominoplasty. Now, a tummy tuck lets us be able to get rid of loose skin. It also helps us to get rid of unwanted fat of the abdomen. Now, when I do a tummy tuck, we typically make an incision down low along the bikini line. That's an incision that usually goes all the way from hip to hip. We make a second incision then that is around the belly button, and then we can remove most of the skin between the belly button and the bikini line. Now, in addition to removing skin and making that flatter and tighter, a second part of what we do with the tummy tuck is that we frequently tighten up muscles. Now, the six-pack muscles, or what we call the rectus abdominis muscles, they're very close together when we're children, and then with weight changes or pregnancies or surgeries or sometimes just normal aging, we get some separation in those muscles. So I take those two muscles and I sew them right back together in the middle so people feel tighter and flatter immediately after surgery. Now, once we get the muscles tightened, then I'm able to pull skin down and take out as much of the excess skin as we can, and then be able to make things much flatter and tighter for everybody. So once we have that skin removed, then we have a space in there that we want to be able to reduce. Now, that space that was created, I used to put drain tubes in to collapse that space, but I changed techniques really about 10 years ago to a drainless technique. Now what I do is I put internal sutures called progressive tension sutures so that I can collapse that space with sutures instead of with drains. That makes the recovery much easier for people because the drains are oftentimes one of the greatest sources of pain after surgery. Now, once we get that space closed and we get everything stitched up, the stitches we put in are all dissolvable, so nothing has to be removed later. We use some compression after surgery, so we have you wear some type of garment to be able to minimize swelling and help you along with your recovery. Now, most people after surgery are going to be in the recovery room for an hour or two until they're awake and feeling good, and then we let them go home that day. Most people need to take off of their daily routine for between a week and 2 weeks. By the end of that time, I would expect people to be off of pain pills and back to driving and doing most of their normal daily activities. Now, I do ask people to have 2 weeks of no exercise of any kind, not even a brisk walk. I want everyone to do things a little bit slower so we can keep your heart rate and blood pressure down, and that just reduces your chances of bleeding or increased swelling or something that might compromise the quality of your final outcome. Now, after 2 weeks, I usually let people get more active. So if you want to do some light cardio activity, that's completely fine. But I still like to limit people on lifting to no more than about 10 pounds for that whole first month. That's just going to help us protect that muscle repair that we did so that you can have a high quality result when we're finished. Now, once we get to about a month after surgery, I usually let people kind of ease back into some more lifting, more exercise activities. And by 6 weeks or so, people can be doing anything that they want to do. Now, I do have people in compression during that whole first month. I do think that just helps to speed along the recovery so you look better faster. But I think that most people feel better with that support and comfort anyway. Now, there are a few risks that go along with tummy tucks that I always tell everybody about. There's probably about a 1% chance of bleeding or infection that we could possibly have to reoperate for. There's also about a 5% chance of an open wound or a healing problem. And that results because we have a significant change in the blood flow pattern to the skin when we do a tummy tuck, and we're relying on a secondary blood supply to keep everything alive. About 5% of the time that may not be enough, and there could be an open wound that develops. Now, if that happens, we will help you take care of it. We always get it healed. Once you're healed, then if we need to come back and do something to help improve the quality of the scar, then we can do that. Now, there's also about a 5% chance of having a fluid collection that can build up under the skin, something that we call a seroma. If that happens, it's usually a minor nuisance. Oftentimes, we just need to put a needle in to suck the fluid away. That's usually not terribly painful because the skin of that whole lower abdomen is oftentimes numb for several weeks after surgery, so it's usually a fairly simple thing if that needs to be done. Now, I also always tell people about another complication that's much more serious, but much more rare. It's the risk of having blood clots that can form in your legs during or after surgery, and those blood clots can sometimes travel through your bloodstream to your lungs that could cause a breathing problem or could even be a risk to your life. Now, that risk is a tiny fraction of a percentage point, but we still take that risk very seriously, and we do a lot of things to try to minimize the risk of having a problem like that. Now, tummy tuck is a really common procedure in my practice. It's something we do practically every day, and it's something that I feel like that we are able to deliver high quality results. So if it's something that you're interested in on having some kind of tightening effect or some kind of improvement in contour, then we're more than happy to sit down and have a consultation and talk about the details.